Hi, I'm Brad Ron of the Gibraltar Insurance Group. Today's video, and the reason I have the earpiece in, it's going to be a little bit longer than the ones I usually do. This is going to step you through the process of turning 65, what to do when you turn 65 as far as Medicare is concerned. If you're watching this, you have questions, my contact information will be in the comments of the video. And here we go, because this is going to take a little bit. We're going to go through this is 2026 version. I'm sure we are now in June. I'm sure that in a few months I'll get the 2027 version of this, and there will be changes all over the place. For the most part, this is what we're looking at for Medicare 101. What are all the parts? How does Medicare work? You've been paying into Medicare your entire life. Medicare is not a welfare system. Medicare is something we have paid for. I had my first job when I was 15 years old. When I made $3.65 an hour, first check was around $36. And most of that, a lot of that was missing because I was already paying for my Medicare back then. So this is not a social welfare system. This is a trust set up by the federal government to pay for our medical care as we get older and over 65. Parts A and B equal original Medicare. Now that is hospital and medical. That is what's considered original Medicare. Part C is Medicare Advantage plan, and D is easy. D is for drugs. That is your prescription drug plan. All this together is provided by the federal government. These are always the carriers, and on the bottom side, those are your Humana, your Aetna, your Cigna. HealthSpring now. This is a picture of Lyndon Johnson signing it into law. Anyway, here we go. When are you eligible? You're eligible when you turn 65. Now we're gonna have a slide on this as well, which is anything 3 months before or 3 months after your birthday. When you're 65, you have to sign up. Now the question is, are you automatically enrolled in Medicare when you turn 65? And the answer is no, unless you were signed up for your Social Security benefits, which then they will enroll you in Medicare. But if you're not signing up for your Social Security benefits, you have to manually go do that, and you have to enroll, and they won't remind you that you didn't enroll. Anyhow, those are the folks who are eligible for Medicare. Also, if you're on disability for 24 months, and you've paid in for your 40 quarters, you're eligible for Medicare. I'll get out of the way so you can see the screen real quick. Things to consider when you're enrolled in Medicare. Am I covered by individual health plan, marketplace plan, group plan, that kind of thing. Part A, this is my opinion. When you turn 65, sign up for Part A. There's no premium, not going to hurt anything. Always sign up for Part A. Part B, a lot more complicated than that. And we'll get into it a little bit why it's more complicated than that in just a few minutes. But here again, this is when you're allowed to enroll 3 months before your birth month, and then 3 months after your birth month. And the coverage starts the first day of the next month. So my advice is 3 months before you turn 65, let's get all this stuff in order so you're ready to go. And that way, on your birthday, you already have your Medicare and you're set for life, essentially. How do I enroll? SSA.gov/Medicare. You can also call 1-800-Medicare to do it. Don't try to go to the Social Security office anymore. They don't really help you there trying to get enrolled in Medicare. You can call 1-800-Medicare, and my advice on that is call them at 3 o'clock in the morning. And people think that's a joke, but it's not. They staff it 24 hours a day. At 3 a.m., the West Coast or East Coast has gone to bed, the West Coast isn't up, or vice versa. You can also scan this QR code. Most of us, as we're turning 65 now, we are tech savvy enough to know what we're doing as far as getting online and trying to sign up for Medicare. My caveat to that, if you're turning 65 and you do not want to take your Social Security, be careful, because on that same screen, they're going to ask you, do you want to sign up for your Social Security benefits? The answer is no, you just want to sign up for your Medicare benefits. And I would say, look, you've paid into this, do it. Just go ahead and do it at 65. A little bit real quick about IRMAA. IRMAA is the income related adjustment amount. If you're making too much money, if you're over $109,000, you're going to pay a little bit more for your Part B. That's just the way it's going to work. They look at a 2-year look back. So if it's 2026, they're going to look at your 2024 income taxes and decide that. If you have questions on IRMAA and how to avoid it, or if you don't think you're unfairly getting hit for IRMAA, give me a call. I'll be happy to walk you through it. But those are the amounts. Original Medicare. If you don't have a Medicare supplement or Medicare Advantage plan, original Medicare, this is what you're going to pay. Days 1 through 60 of hospital stay, you pay a deductible of $1,736. That's going to be annually. That's going to start back every year. After 61 to 90 days, if you're in there that long, God bless you, but you're paying $434 per day. Anything after 90 days in the hospital, you're paying $868 per day. That can add up really fast. And this is coverage for skilled nursing facilities, day 1 through 20. You have a $0 copayment, days 21 through 100. You have a $217 copayment, and anything over that, you're paying all the costs. Medicare does not pay for your nursing home. Just know that. To find all the costs associated with it, you can scan this little QR code in the corner, and they will bring you to all the different costs that you're doing with Medicare. Now, the big thing is with Medicare, there is original Medicare. There is no max out of pocket. We're talking about Part B here. Part B covers your doctors. Now, there's an 80-20 copay with, 80-20 coinsurance with Part B, which means you're paying 20% of all your doctors every time. Now, where that gets expensive is you're in a hospital, you're having a surgery. The hospital costs are there for your Part A, but there are doctors that you're seeing that are going to bill you separately. Your anesthesiologist, your surgeon, your cardiologist, whoever's in there, your PCP, any of those PAs that are coming in there, they're all billing separately. So this is where you can get in trouble as far as financially with just Parts A and B or just original Medicare. That's where that becomes an issue because original Medicare Parts A and B do not have a max out of pocket. There is no stopping point to the bleeding. The ways around it are Medicare supplements. Here's what you're seeing here is a Medicare supplement. These are all the different plans. Look, really a simple, Medicare supplements are very simple. There's a premium. You're going to pay for it every month. You go to the doctor, you put your card down, doesn't matter which doctor, if they take original Medicare, you can go to any doctor you want. Put your card down, you get whatever done, and you leave. There are copays and co-insurance and deductibles with those Medicare supplements. You see this whole big chart here. Okay. Here's the thing. You're really looking at this point plan G or N. You can't get C or F anymore. Those are been discontinued. The rest of the plans leave gaps that are way too big. K and L, they'll be cheap as hell, but you're not insuring yourself. G is where I would go because excess charges are in G, not N, and excess charges are at 15%. They can charge up to 15% more than the Medicare rate. Any doctor can do that. It's not illegal by law, so that's where we're at on that. So I would look at a plan G. Do not look at a plan G high deductible. That's my opinion. It just doesn't seem worth it to me when you can have an Advantage plan that will do the same thing for you that wouldn't cost you any premium. All right, Part C. Part C are Medicare Advantage plans, also called MA plans, also called MAPD plans. They often include your prescription drug plans where Medicare supplements do not. Medicare Advantage plans work instead of Medicare, but you still need your A and B because you are working with the carriers, whether that be Humana, United, Blue Cross, we call them the BUCA carriers, Blue Cross, United, Cigna, and Aetna, but Cigna is now HealthSpring in the Medicare side. Medicare Advantage plans work more like a group plan. You're going to have copays and coinsurance. There is no deductible with those, but you do have copays and coinsurance that you have to look at. Big thing is they do have a max out of pocket. So if you look at your max out of pocket, that's the most you're going to pay per year. You put that money aside, and if you have any medical expenses, you take it out of that. We'll move on from there. Medicare Advantage, they do have networks. So you've got to make sure your doctor is in that network for that carrier. It's going to vary and it changes. For example, there's a company called WellMed. They no longer are working with a company called Humana. Now all those folks that were going to WellMed who had Humana, they have to make a choice whether they want to switch providers or switch carriers. That's happened. But you know what your costs are going to be every year on a worst case scenario. What I mean by that is if I have a $4,000 max out of pocket, I know worst case scenario, I'm paying $4,000 out of pocket to be in the hospital and I'm paying $2,100 for my Part D. So $6,000 is what I'm paying if the worst case scenario happens. 90% of people on Medicare Advantage plan do not get close to their deductible. I'm sorry, their co-insurance, their max out of pocket. It's not a deductible. They don't get close to their max out of pocket. 90%. So most likely you're not going to be spending that kind of money, but you do know if something bad happens where it's going to end. And those are annual, by the way. Medicare Part D. D is easy. D is for drugs. Every carriers do all your Part D plans. Make sure your max out on that is $2,100. There is no catastrophic limit anymore, but $2,100, I think it's going to 2027, part of the Inflation Reduction Act. The carriers are taking more of the burden here. You're going to pay your deductible on that, and the plans are going to vary in what drugs are on their formulary. So what you want to do when you're looking at a Part D plan is whatever drugs you're taking, make sure they're on the formulary, make sure they're covered, because they do vary from plan to plan. Star ratings. We're talking about Part C here in Medicare Advantage. They're all rated 0 or 1 to 5. They also do half stars, and it is a whole. I'll let you see the screen, but it's the measures they're doing in the background, in my opinion, are only the government can come up with such a rating system. But you do want to look at the star ratings. Anything over 2.5 stars is average. And 3 stars and above, what you're seeing most plans are going to be probably fine. 5 stars do trigger a special election period where you can sign up for them at any point. How do we want to get our Medicare? Option 1 is a Medicare supplement. Option 2 is Medicare Advantage plan. You look at these, really, it is like going to McDonald's and ordering the combo meal. The combo meal is your Part C. The combo meal is your dental and vision, your medical coverage, and your drugs all in one, kind of rolled in together. Medicare supplements a little bit differently. That's where you're going a la carte. You're going to order the cheeseburger, you're going to order the fries, and you're going to order the Coke. Maybe you don't want the Coke, so you don't order that. That's how Medicare supplements work. And look, if you have questions on that, my info is always in the comments. You can call me. I'll be happy to answer some questions for you. So what's the difference between the two? Both of them you have to be enrolled in A and B. Big deals. Part C or Medicare Advantage, you do have a network. The word's called network. May include Part D, usually includes Part D. This definitely does not include Part D. You're paying a premium. There is no premium with most of these. There are a few that do have premiums, but for the most part, there's no premium. This is guaranteed issue. I don't care how sick you are, how bad your health is, they have to take you. After 65 on Medicare supplements, they do not have to take you. That's just the way it is. And the downside here, you are subject to enrollment period, so talk to me in October, I can get you a Medicare Advantage plan, or when you're turning 65, that springs what's called a special enrollment period, which is it's your initial enrollment period. When you turn 65, you can get a Part C plan at that point. And when you turn 65, these are on a Medicare supplement, these are guaranteed issue for 6 months. And then after that, they're looking at your medical bureau. So how do we choose? You want to look at the costs. Do you have the money? Do you not have the money? Your needs, what benefits are being included, and a big thing is your providers. Make sure you're able to see your doctors. And if you don't like your doctor, you're not married to your doctor, not a big deal. Go to find another doctor. It makes it easy if you're trying to find another doctor. But if you really like your doctor, then let's make sure your doctor is going to take whatever plan you decide. Few important terms, and these are important terms. Premiums, what you're paying a month, you're used to paying premiums. We're all used to paying premiums, whether that's car insurance, home insurance, or in this case, your Medicare. Copay. Copay is a fixed cost that you pay. Copay is not co-insurance, they're not the same. Copay is a fixed cost. So if they're going to say, the plan says your copay is $25 to see a doctor, then every time you go see the doctor, they're going to bill you $25. That's your copay. You know what it is. A co-insurance is a percentage. So now you go to see your doctor and they say you have a co-insurance of 20%. Your doctor charges $200. Now you're paying $40. But if your doctor is $400, you're paying $80. So you're paying a percentage on that. That is co-insurance. Deductible is the amount you must pay before any coverage kicks in. And really, deductibles come into a Medicare, original Medicare and Medicare supplement plans. Medicare Advantage plans do not have a deductible max out of pocket. Very important. For me, this is the most important right here, is your maximum out of pocket. That is where the bleeding stops. With original Medicare, there is no max out of pocket. With Part C or Medicare Advantage plan, there are some max out of pocket. With Medicare supplements, there is technically a max out of pocket, because once you cover your deductibles, the Medicare supplement pays the rest. So this is where you want to make sure, you have to make sure you have a max out of pocket, or else you can get burned badly with just original Medicare. There's a late enrollment penalties. We talked about that a little bit earlier, and there's also the monthly adjustment if you're making over a certain amount of income. Not going to spend a lot of time on these, but there are still dual eligibles, which means you are both on Medicaid and Medicare, or you're on, you have chronic conditions, something like diabetes, COPD, cardiovascular. There are certain plans that are just for those kind of conditions, and if you need a special needs plans in some markets, those CSNPs, which is chronic special needs plan, are really tailored for those conditions. Also, you have to have Part A and B, and if you're on Medicaid, you qualify for what's called a dual special needs plan. So those plans usually have more benefits and less cost to them for those who are on Medicare and Medicaid. Potential mistakes. Look, guys, you're getting phone calls, you're getting emails, you're getting texts, you're getting bombarded in the mail. Look out for important mail. They will disguise their mail to make it look like it's coming from Health and Human Services. They're gonna keep on sending them. They're gonna try to get you to call in. Don't. Unless it's from Health and Human Services, and then make sure the number is actually the government number, because what they'll do is they'll send you these letters, make it look very official. You have to call in and check your coverage, and they are actually just scamming you and slamming you into a plan that you don't want to be in. As seen on TV is another one. This is a big one. You're going to see a lot of ads. There's a lot of ads. On daytime TV, there's most of them. They recently changed the way you cannot talk about plan benefits. You can't advertise, hey, we're going to get free groceries, or you're going to get free sneakers, or free whatever. That's gone away. But now what they will do is they'll advertise, do you need hearing aids? This is the big one. Call in for free hearing aids. What they're actually doing is trying to push you into a Medicare Advantage plan that includes hearing aids, and they're really crappy hearing aids too. They're trying to get you to call in for that, and they're going to try to sell you a Part C plan that includes hearing aids. They found their loopholes easily. Talk to somebody you trust on this stuff. If you need help, talk to somebody that you know that's local that can help you out. Identification numbers, don't give out your Medicare number to anybody. Once you get it, and it takes, after you sign up, it takes about 3 weeks to get your Medicare number. If you need it faster than that, let me know. I can usually pull it with your Social Security number. But don't give out your Social Security number or your Medicare number to anybody that you don't trust. With a Medicare number and your date of birth and your zip code, I can write you a plan right now. I'm a licensed agent. I've been doing this for 20 years. I can go into my little computer here and I can write you a plan with just those 3 bits of information. Whether you liked it or not. You can complain, it's not going to do any good. I wouldn't do that because I have some ethics and morals in my business, but if you don't, it happens all the time, folks. All right, I hope this still works. If you need help, I've talked about my contact's going to be in the comments below, but you can also scan this. I'll give it a few seconds and I'll take a breath. There it goes. Okay, that will give you my contact information. You can also contact me there. That's going to give you my number on my phone. Here's my information if you need it. Again, it's going to be in the comments below. If you need help, any questions, this was real fast, guys. I was just trying to give you basic information. There's a lot more to it, and I'm happy to help you out if you're having any questions as you turn 65. It's a wonderful time in your life because now we're getting to the end, and we get to kick back a little bit, right? I'm Brad Bronner with Gibraltar Insurance Group. Give me a call if you need me. Thanks.